What's up, Snatch Life?
Yeah.
Oh my God, look at
Vamos a
me.
ver.
I had to curl my hair and zhuzh my hair up a little bit because I'm here in the office of
Está
my
bien.
new surgeon. He's fine too, and I love him already. So
Okay.
in a
Ya
few
yo sé
minutes,
dónde es,
he's
sí.
on the phone. I'm going to
Bueno,
turn the
hablamos,
phone
bro.
around
Okay.
so that you guys can see him. So I'm going to have him do like a Q&A and talk about like his services and everything that he does. And yo, he is such a vanity man. When I told him that I wanted to come online, he said, wait a minute. He combed his hair, and now, why am I wearing these glasses? I can't see. And he combed his hair, and then he put on his diva light. So hold on, let me adjust myself so he can look good on camera. So he's going to talk to you ladies about his services, what he offers. He's going to talk about like BMI, his name, the whole shebang. So this is my new doctor. So no one have any fear. Like Jose Decina, I'm not going to him, and I'm going to delete that entire thread off of Snatch Life. So here, without further ado, and ladies, oh, you know what? Can I give you guys a moment to get your panty liners? Because he is fine. So some of y'all will be a little moist. So, oh, thank you, babe. So I'm going to flip the camera around. Any questions that you guys have, I will ask him in the end about as far as like where your BMI should be, what he offers, and everything else that he does. So I'm going to have him give you a lot of description and whatever questions you have in the end. And please try to, even if you put your questions through, I'll remember them in my head. And if I forget in the end, let me know and I will answer them. So let me start my intro because I didn't. Hey everybody, hey Snatch Life YouTube, hey Snatch Life Facebook. This is Cindy. I'm still here in the DR. I'm on my final days. I'm meeting with my ultimate doctor, and so I'm gonna flip the camera around so he can do the Q&A, but first he will start with telling us about himself, and you know how we do this. So let's get into it. Thank you ladies for tuning in.
Hello, good afternoon. My name is Manuel Peralta. I am doctor. I am plastic surgeon. I am studying in Dominican Republic the medicine in tech, and later I will go to Brazil. I did Surgeon General in Brazil, in Rio de Janeiro, and after this I will do plastic surgery in Ronaldo Pontes Institute, one of the best
in the world
of facelift and body contour. After this, I will go to Cleveland to do facial and nasal surgery. After this, I come back to my country, to Dominican Republic, and I am working in CECILIP in Santo Domingo and CECIP in front of the House of Government. I will do all the surgery for body contour, liposuction with Vaser, and micro air is my tools for the liposuction. I think that is better for the recovery for the patient, less bruising, less pain, and the time down that the patient will need to come back to the work is very, very, very small, 2 weeks. I work it with the breast, implant, reductions, reconstruction, and everything that you need in this area. In the facial area, I will do rhinoplasty, I will do facial surgery, otoplasty, and blepharoplasty. It's important for me the security of the patient. It's important that evaluation for cardiology and anesthetic department. I don't think that if you need the beautiful, you first need the security and the health. If you have the security and the health, the beautiful will come back along with you. Nice to meet you.
Talk to the women about you only talked about like you do the Vaser and the air. So you do the whole mommy makeover, you do everything. Talk to the ladies about their BMI, the maximum BMI.
My maximum BMI is 33, 35 because the patient that I will see often have 2 or 3 childs or 2 or 3 weeks after evaluation with other doctors. I think that the patients that have bariatric surgeries with the weight loss massive, it's important to evaluate how many procedures do you want to do. I prefer combine body, back, and abdominal area, and after teeth, liposuction with breast. It's important for the security. The recovery is very comfortable when you don't mix everything in one round.
Yeah.
I prefer divide in 2 rounds.
Okay, and that's for like most mommy makeover or just for bariatric patients?
The mommy makeover usually we will do with patient with 2 or 3 beards, and the patient with weight loss is important divide because the flaccidity of the arms, flaccidity of the back, of the abdominal area, we will do many procedures, back lift, abdominal, and after teeth we will do a liposuction with laser for the tightening of the tissue.
This is your name again, Dr. Manuel? Say your name again.
My name?
Yes.
My name is Manuel Peralta, and Instagram, Dr. Manuel Peralta.
I will put his Instagram, ladies, down, lady. This is going to be my new doctor. This was the Claudia recommendation. So here we are. So everyone, you guys are going to be in here talking about Dr. Manuel instead of Claudio. But yes, so can you talk, a lot of ladies are concerned, you're welcome, Melissa. A lot of ladies are concerned about like the number of like deaths recently in Santo Domingo, because it just seemed to, like Dr. Yealy had 2 recently, like within back-to-back within a month. Like, we don't know why those incidents occur, but can you tell the ladies what they can do to be healthy when they come here to Santo Domingo and to be ready for surgery, as far as like smoking, hookah, whatever it is that they're doing?
I think that the principal thing that we will know about the prepare for the surgery is the hemogram, cell blood count. If you have an anemia, you can do the surgery. Apart from the smoke, apart from hookah, if you don't have the alimentation, the nutrition for you recovery from the surgery, you need to change this. It's important that you will do the hemogram, the cell blood count, for we will check the hemoglobin levels. If you have low hemoglobin levels, we will start with iron treatment for increased this level, because remember, the hemoglobin is the principal function transport the oxygen for the
blood,
tissue.
yes.
For the cicatrization, the oxygen is the most important part. If you have low hemoglobin levels, you don't receive the complete oxygen in your scar, and you will traumatize this area, and you will not recover it that you want.
The women on my blog are very informed about blood levels and hemoglobin. They are pretty much a lot of the women on my blog are like undercover hematologists. They can tell you everything about the blood.
Yes,
they're very informed. How about deaths and infections? Have you had any this year?
When I start my formation from surgeon, the principal thing that we will do is clean all the area, clean all the instrumental, and third, antibiotic therapy post-operatory. I am not immune that one patient have an infection, but my population of patients, I don't have infection, thanks God.
Okay.
Because all my patients are very clean.
Yes, Melissa, that's exactly who he is. Yes, so he has a low infection rate and death rate because he is cautious and careful. He's not here trying to take all your money at once. He will tell you to come back for a second round if what you want to achieve is too much in one round. Like the safety of his patients is number one. So, let me see. Oh, thank you. I have sent, okay, you're getting some friend requests on your IG. So people will be friending you. He's at how do you pronounce this clinic? Sisilip? He's at Sisilip. Is this where you do the surgery?
Yes.
Yeah. Oh no, they're familiar with Santo Domingo.
We have 6 surgery rooms here and 23 rooms for the patient.
Hell no, he's not at Cipla. Watch your mouth. I would not step foot in Cipla. Walking there as no, he's in Sisilip. Cecelip, not Cipla, girl. Ooh, no way, not Cipla. We don't do Cipla around here. If you walk into Cipla as a normal person, if I walk into Cipla right now, not even having surgery, I may die from just walking in there. Yes, that's where Medina is.
Yes, it's the same.
She's in the same floor. They're on the same floor.
Medina is my friend. We studied together in the university.
And remember when I came here in 2018 to have that interview with Andrea Carderish? I'm right next door to him. So it's so weird that I'm like, this is kismet. I was literally here 2 years ago around the same time in that office.
Perfect.
Isn't that weird? And here I am today. So yeah, so no, he's not in Cipla. Ooh, someone please delete that comment. Oh no, honey, we don't do Cipla on Snatch Life. You can enter at your own risk. You had, in CSEP. Okay. So anyway, I guess if you guys don't have any more questions, I leave his Instagram information on. And then you guys, his Instagram is private. He'll have to like accept you for your Instagram. But like the BMI is 31. You guys know all this about the blood stuff that you have to do.
35.
Okay. Do you do vasor lipo and air lipo and everyone, or do you regular lipo and other people?
Usually I do. Because it's better for the recovery.
Okay, so he uses the vasor and the air lipo because it's better for recovery. And those will work even with women with a higher BMI?
With the higher BMI, we don't have the best result because you need to tighten in the skin. When you have a lot of cap of fat, you retire. But the vasor working with 3-4 centimeters of fat is good, but it's not the same result that with the BMI of 28, 27. It's different, but you have a result. You see the result.
Okay, do you use guided laser?
No, I only use vasor lipo and micro air and J plasma. It's the only 3 that I would use.
Okay, so his 3 are the vasor lipo, J plasma, and micro air. Do you liposuction the knees? Yes, girl, he's about to do my knees. I hope he does, because I'm in the wrong place. I need the knees to hip lipo. He's also going to get rid of the nasty, ugly, yeely lats. Thank God. Yes, he does. He lipos the knees, right?
Yes.
Are there anywhere in the body that you do not lipo?
Yes. If you have fat, I will do a lipo.
If you have a fat... Okay, maybe I have a new doctor. Yes, girl, we all have a new doctor. Yeah, Melissa Rose, I hate my knees too. Yeah, this is our new doctor, Dr. Manuel, and he's like nice on the eyes, right? Okay, so I'm excited too. So I'm going to come back. He told me I was okay. I was normally going to wait 6 months, but he told me that I am okay in 4 months. So we're making this happen in 4 months. Is there any more questions? Because Dr. Manuel is open for me. And so actually, if you guys have any more questions, what I'll do is I'll just try to text him, and when he's available, he'll respond to me at his whim. But I'm coming back like the 9th of January. So if I come back, I'll call him to see if he has time. And then you guys just put your questions and we'll get back to it another day. Or I'm going to send you, what looks does he give? Oh, they're slamming. Put on his Instagram. Get yourself on his Instagram, and then you can see his work. And then you can ask him your questions. Let him know that you're from Snatch Life. Hey, Maria. Let him know that you're from Snatch Life from Cindy's blog. And he will get at you when he can. So that's it. I'm going to let Dr. Manuel go. And ladies, thank you for tuning in. And any questions that you may have. And I'll definitely do another video later on tonight about what I experienced here in his office. But that's it, girls. I'm out of here. Have a good one.
Bye-bye.
Say goodbye, Dr. Manuel.
Bye-bye.